KGW has learned a patient was injured on the operating table at OHSU after a fire started while surgeons were using a cauterizing tool around flammable high-flow oxygen. The hospital acknowledged the dangerous situation this week after we started asking questions. The fire happened in December. The hospital immediately launched an investigation into what happened, and federal regulators later conducted their own investigation. The details we've learned from that follow-up offer some clues about what went wrong that day. The hospital was ordered to update its instructions on the use of high-flow oxygen, cautery equipment, and an alcohol-based antiseptic. When surgical fires happen, it often involves a combination of those three things: oxygen, a heat source, and fuel to keep it going.
It's kind of a prime situation in surgery because you're oftentimes using supplemental oxygen when a patient's under anesthesia. A lot of surgical instruments or surgical approaches use cautery or create sparks.
Brett Morgan, with the American Association of Nurse Anesthesiology, says the surgical community takes this risk seriously, and breakdowns in communication are often to blame. Barbara Malonga, an investigator for the nonprofit ECRI, the Emergency Care Research Institute, agrees.
Let's face it, the ignition source is handled by the surgeon usually. The oxidizer, oxygen, is handled by the anesthesiologist. And the nurse is the one that's handling, the drapes and the fuels and stuff. So that team all has to work together to prevent this risk.
However, both Morgan and Malonga say this doesn't happen often.
Very uncommon. A surgical fire is a catastrophic but rare event.
It's very rare that we get a surgical fire call that has resulted in harm.
On Monday, the federal investigators approved the hospital's plan for, quote, long-term sustained resolution. Among 65 million surgeries performed in the United States each year, ECRI estimates there are about 90 to 100 surgical fires.
The procedures that are at highest risk are those that involve the head, neck, face, and upper chest area because of the close proximity of that oxygen source on the face to the ignition source.
Morgan says in most cases, surgical fires are preventable.
This is an element of our training. It's an element of our professional development.